Can you get a urinary tract infection, UTI, from having sex? For many people, the chances of having a urinary tract infection UTI increase with sex. But a UTI isn't a sexually transmitted infection, STI. The types of bacteria that cause UTIs are commonly found on everyone's skin. Sex increases the risk that bacteria from nearby areas will get inside your urinary tract and cause an infection. For some people, this tends to happen over and over again. Fortunately, good treatments are available. There are also a number of things you can do to prevent UTIs when having sex. What is a UTI? UTIs are infections of the urinary tract. The urinary tract is the system that creates, collects, and gets rid of urine from the body. A UTI occurs when bacteria enter the urinary system and find a place to grow. The urinary tract begins with the kidneys, which create urine. The ureters, a pair of tubes, carry urine from the kidneys down into the bladder. Urine is held in the bladder until you're ready to empty it. When you go to the bathroom, urine comes out through your urethra, the tube that connects your bladder to the outside. UTIs can happen anywhere along the urinary tract, and this affects both the symptoms you feel and the treatment you need. A UTI includes A. Kidney infections, pyelonephritis. A. Bladder infections, cystitis. Urethra infections, urethritis. Usually, when people talk about a UTI, they're talking about a bladder or urethra infection. UTI symptoms. The most common symptoms of a UTI are pain or burning when you urinate, an urgent need to empty your bladder, you need to urinate frequently, cloudy, pink, or blood-tinged urine, and mild discomfort of the lower abdomen, where the bladder sits. The symptoms of kidney infections, pyelonephritis, are more severe. Fever and vomiting. Pain in the back or side. A kidney infection can happen when a bladder infection goes untreated. Bacteria then travel farther up the urinary tract into the kidney. UT is from having sex. There's a clear link between UTIs and sex. This is because the friction involved in sexual activity pushes bacteria toward the urethra. Anything that allows or encourages bacteria to enter the urinary tract increases the risk of a UTI. Data shows that UTI symptoms most often begin about 2 days after having sex. To understand why sex causes UTIs, it helps to know that most UTIs are caused by bacteria from the gastrointestinal (GI) tract. Over 80 of UTIs are caused by Escherichia coli. EDs are caused by Escherichia coli. Coli, bacteria. These germs are normal and common inside the intestines, where they help with digestion without making you sick. The other bacteria common in the digestive tracts of healthy people that cause UTIs are mostly Staphylococcus saprophyticus, E. proteus, Pseudomonas, K. Klebsiella, Enterobacter species. Often, bacteria from the gastrointestinal tract are also found on the skin around the anus. In people with typically female genitals, the rectum is in the back, the urethra is in the back, the urethra is in the front, and the vagina is in the middle. Having sex can force bacteria from the rectal area forward, toward the vagina and the urethra. Anything that pushes germs toward the opening of the urethra increases the chances of infection. Some types of contraceptives contribute to sex-related UTIs as well. Spermicides, including the spermicides on some condoms, change the interaction between bacteria and skin cells by making it easier for bacteria to attach to the inside of the urethra. Contraceptive diaphragms are also associated with UTIs. In addition to containing a spermicide, a diaphragm can press on the urethra and cause urine to become trapped. This interferes with how urine flow can help wash bacteria out of the urethra. Sexual activity itself can make it easier for some species of bacteria to grow. When skin in the genital area becomes chafed, bacteria are able to live there more easily. Those that normally live in the genital area can grow in larger numbers. These shifting populations of bacteria contribute to the connection between sex and UTIs. Can a man get a UTI from a woman? If a woman has a UTI, it can't be passed to a man, even during sex. This is because a UTI is an infection within the urinary tract, which is different from the vagina. The penis doesn't enter the urinary tract during sex. UTIs occur when your urinary tract gets infected with your own bacteria. They're not passed from person to person. Having sex with someone who has a UTI doesn't mean you'll get it. Can you have sex with a UTI? It's probably a good idea to avoid sex while you're being treated for a UTI, although there isn't a hard rule. Some healthcare professionals recommend avoiding sexual intercourse until you finish your course of antibiotics. For one thing, you're probably not feeling well. There's also the concern that having intercourse before the infection has gone away can send the bacteria farther up your urinary tract. This could lead to a worsened infection, like pyelonephritis, an infection of the kidneys. Lastly, having sex can irritate the genital area, introducing even more bacteria to the urinary tract, which isn't great if you already are fighting an infection there. Once you finish your course of antibiotics and you're feeling well, it's perfectly safe to have sex again. How to prevent UTIs from sex? UTIs should be treated to keep them from getting worse. This usually requires a prescription for antibiotics. Since going to see a healthcare professional every time you have sex isn't reasonable for most, it's helpful to think ahead. Here are a few things you can do to prevent a UTI before it starts. Urinate after sex. The easiest thing you can do to reduce your chance of getting a UTI after sex is to urinate immediately after sex. Since a UTI is caused by bacteria making their way up the urinary tract, urinating after sex helps prevent that from happening by flushing the bacteria back out. Experts disagree on how effective this method actually is at preventing a UTI, but it's a quick and easy thing to try. C. Wipe correctly. Always wipe from front to back after using the toilet to prevent bacteria from the anus entering the urethra. Drink more water. Drinking more water has also been shown to decrease your risk of developing a UTI. Staying hydrated is thought to help by diluting the bacteria within the urinary tract, preventing it from establishing an infection. A. Avoid spermicides and diaphragms. If you use spermicides or a diaphragm for birth control, you can consider switching to another form of birth control to help prevent UTIs. Since spermicides and diaphragms are associated with an increased risk of UTIs, switching could help minimize your risk. Wear breathable clothing like cotton underwear. Choose breathable, cotton underwear to reduce moisture buildup. Avoid tight clothing. Tight clothing can trap moisture and create an environment where bacteria thrive. K. Consider preventive antibiotics. Last but not least, your primary care provider could prescribe prophylactic, preventive, antibiotics for UTIs. This is done very rarely and only for women who have frequent UTIs that keep happening after sex. Prophylactic antibiotics are taken as a single dose right after sex and helps prevent a UTI before it starts. And consult your healthcare provider. Discuss recurrent UTIs. If you frequently get UTIs after sex, talk to your doctor. They may suggest a preventive antibiotic or other strategies. Regular checkups. Regular medical checkups can help detect and treat any underlying conditions that might contribute to UTIs. By incorporating these practices into your routine, you can significantly reduce the risk of developing a UTI from sexual activity. Remember, if you experience symptoms of a UTI, such as a burning sensation when urinating, frequent urge to urinate, or cloudy urine, consult a healthcare professional for appropriate diagnosis and treatment. Stay proactive about your urinary health and enjoy a healthy, active sex life. Thanks for watching, and remember to like, comment, and subscribe for more health tips.